Hi, I'm Trish Maynes. I'm here today to discuss the consult review sheet. While our previous versions met an assortment of objectives, this new consult review sheet offers a new means to measure performance improvement through reports and a standardized evaluation tool. The new consult review sheet gives an objective view of clinical performance. As you know, each step is marked complete without error, complete with minimal error, needs improvement, or the most recent update is not observed, indicating a step either skipped by neurology or due to the patient's inability to comply. We send the review sheet with the expectation the consult is reviewed with the nurses who participated in the exam. The score sheet then gives you the opportunity to do additional targeted training with that nurse to improve in performance, in times, or in medication delivery. If there are additional areas of concern in the consult, there is a signature line indicating that the consult has been reviewed and areas of attention have been addressed. These reports are not meant to be hypercritical or in any way discouraging. They're merely a segue to improve our patients' outcomes. As outreach nurses review the consult sheets, we are able to evaluate each step of the consult and identify our areas of concern or areas where the nurse excels and deserves recognition. We are able to offer consistency where we all look at the same details and be objective due to the standardization of the review. The consult review sheet can offer you, as the nurse facilitator, data on individuals, data on times, and data on areas where specific areas of training are needed. The consult review sheet is a tool to help you identify your strengths or your areas needing improvement, and your strengths include identifying your strongest performers, those most knowledgeable of the consult process, and those who get the job done most efficiently. These nurses are a strong resource for your less experienced staff and should serve as backups during your consults. The consult review sheet will also help you identify areas needing improvement, such as where are your less experienced nurses struggling? Is it on the exam? Is it on TPA administration? Or are they just having trouble making the call? So this form will help you identify your strengths, areas needing improvement, and it shows you areas or shows you trends for better or worse. Now let's review the longest 7 minutes of your life. The fine details of a successful NIH exam can be completed in about 7 minutes. We're going to highlight the details that are most often overlooked during a consult, starting with the level of consciousness. When you're doing your instructions, be direct and give commands such as open your fist, close your fist. Best gaze. Can we see the patient in the camera? Make sure you remove the patient's glasses and move the finger horizontally left to right and see if the eyes cross the midline. Visual fields. This is the most challenging step. It's visual fields. As you review the exam, the fine points include have the patient look at you and ask them to point. Personally, I can't remember right from left on a good day, so let's not challenge our patients who are struggling with this task. Hold your arms up shoulder width apart. Begin at the forehead, wiggle fingers right, left, and both sides, and then drop your arms to chin level. Wiggle fingers right, left, and both, and move on to the next step. Motor. Always begin with the unaffected side. Fully extend the fingers, and the limb is horizontal to the stretcher. Be sure to give visual cues as you count to 10, and lean your patient back and count to 5 when you're doing the leg portion. Ataxia. On the arms, it is done in 3 fields, not 1. It's side rail, middle, and second side rail. Always again begin on your unaffected side, and full extension of the arm is important. Ataxia-lower heel to shin. The heel should stay in touch with the lower leg. Go up and down on the opposite leg and be mindful of shoes and boots to avoid injury. Sensory safety pin. Sensory safety pin, remind your nurses the exam requires 3 light taps of the safety pin bilaterally. Begin on the cheeks, proceed to the lower arms and the lower legs. Ask, does it feel the same? If not, ask, how is it different? Best language. Give the patient their glasses. Let the patient hold the cards if they're able. Point to the items on the list, on the naming list. On the kitchen scene, can the patient identify something in each quadrant? Be sure to give them adequate time and don't prompt the patient. When it comes to words and sentences, can the patient read? Do they have their glasses? If they can't read or can't see, ask them to repeat after you. And the final step is extinction. This is 1 light tap to the cheeks, right, left, and both, the lower arms, and the lower legs. It is simply a light tap, no dragging of the fingers, no heavy pressure. If your patient is receiving Actiplace, please verify your patient's weight, the medication on the camera, mix in view of the camera, your bolus, waste, and infusion are all confirmed with a partner or a teammate present in the room. Follow the infusion with a chaser of 50 cc's normal saline running on the same tubing, and be sure to use a pump-appropriate vented tubing for administration. Now, details. Of course, we all push for rapid times and treatments, but let's not forget the preliminaries. When it's all said and done, and we find out the blood sugar is 25, was all this necessary? It's a lot of time, effort, and money if AMP of D50 is all we need to do to get this job taken care of. So getting a finger stick on arrival prior to CT is crucial. And if it's arrival by EMS, their readings are acceptable. So the review sheet identifies our needs and our strengths. It identifies trends for better or for worse. It identifies training needs. It identifies areas for performance improvement, and it identifies your strongest performers, leaders, and stroke champions. So, celebrate your success, and in conclusion, use your information to celebrate your success. And then celebrate your patients who have amazing outcomes and are home loving their family and living life to the fullest. And this slide shows some of our survivors who have generously shared their stories with us. Thank you.